Welcome. Thank you for taking the time. Thank you for hurrying back from lunch. And I promise you it was worth the hurry. We are here to essentially talk to an initiative that we've been undertaking for the last year or so within two organisations, both Pathways nationally and Q-nique within the Wellington region here, where we've implemented two outcome measures as part of our routine practice now, our routine recovery practices. So we're going to talk to you and quickly talk about why outcomes. Why is it that we're actually undertaking this venture? The process of choosing a tool very quickly, the process that we used with the support of some work that had been undertaken by Amokeen. We're going to talk to, or just introduce the two tools that we're using to you, the World Health Organisation Quality of Life measure and also a social inclusion measure from the New South Wales Health called the Activity and Participation Questionnaire. And the key focus of what we're going to get across today is around how we went about capturing the hearts and minds of both the people who use our services and the staff of our services in order to really have outcomes an integrated part of what they're doing. So how do we socialise outcomes within the organisation? And we are aware that we're really, really in our infancy in this process, and this has really only just begun for us. So we'll give a brief snapshot of what are some of the key things that we think we need to understand going forward, really. Sound cool? Sounds fantastic. Lots of nods. There will be time for questions at the end as well, so we'll try and get through this as quick as we can to give an opportunity to really engage in some discussion with you all. Why measure outcomes? On a personal level, it's really critical that we measure and track process and the notion of wellbeing and recovery for people. And we understand that it's actually really important to understand the perspective of people using services, and that a subjective measure of wellbeing was really required for us. We've been benchmarking social indicators for a whole range of years now, but what that wasn't telling us was, so what? You know, is it actually making a difference for people? Are they feeling satisfied with their life? Are they feeling satisfied with how things are going for them? We believe very strongly, and you'll hear it throughout this presentation, that a measure that's actually rated by the person themselves gives them voice, and we believe that client-rated measures are a way of empowering people to really tell us what's important to them and what they want us to be focusing on. We think it obviously helps understand the actual outcomes people experience, and we believe that at a personal level, routinely implementing outcomes with people increases our accountability to them, because if they tell us they're dissatisfied with something in their life and we then do nothing about trying to address that for them, then we're actually not being accountable by any stretch. So this is about giving people that voice as well. At a service and organisational level, we believe that it drives quality and service improvement. It helps us build evidence to what we do. Our sector does some amazing, amazing work, and we don't always grab and hold and build evidence around that. So using a routine outcome measurement tool is actually going to help us build evidence and contextualise our practice. A really good outcome tool should complement recovery planning practices. It should help us do recovery planning, and we've found to date already, and some of the excitement that we're having around that is exactly the case when done right. And it also assists us in setting kind of performance targets and specific strategic direction in the organisation as well.
Oh, thanks, Ross. I'll stand a bit to the side because you might be able to see me. At a systems level, of course, it's about ensuring the person still is actually at the heart of the whole process, which is what we're here for. But just talking to the total system, it's really important that NGOs are capable of and are taking more leadership for building sector capability in this area. NGOs increasingly required to show their value, what they can do and contribute. So we're looking at this project and the tool we're using, the tools, assisting our staff to engage more meaningfully and capably with the people they serve, and engaging more effectively with primary health care and DHB clinicians. And you can't underestimate how important that is for how they're seen to be valued, not just doing the job they've done well for years, but being seen and visible. As Robin said this morning, information helps with the conversation. As well as building NGO capability using outcomes, also allows us to showcase good practice. So other factors we've been working with to get to this point, I'll just add in here, we waited till the system was automated so the staff energies are not dissipated with a lot of data, a lot of paperwork. because they really need to be working with the people in that therapeutic relationship with the people they serve. So we waited for the system to be automated, which is where we're at now. And it's for ease of service users and for ease of staff. And quite soon, in the very near future, service users will be able to access their own data and complete the outcome tools themselves as part of a client empowerment model.
So having got this far in the project, we had to decide how we were going to choose what outcome measures to use. There are a whole lot available. We formed a reference group between the two organisations, Ross and some colleagues with Pathways, and myself and Angela with Q-nique. We initially honed it down to 25 outcome measures, including some New Zealand ones. We were definitely going to go for existing outcome measures. We didn't have the resources and capacity or the ability to develop any of our own. So we wanted something that was tried and used, trialled and already previously used. Yeah. So we put together some criteria for choosing them. Our criteria weren't solely developed by ourselves. We got criteria from the AMHOC group. All the criteria are important. Being the service manager who is going to be working with a group of support workers within Q-nique, I guess my focus was it had to be really pragmatic and usable by the service users with the client. Had to meet various other criteria as well, but it had to be something that service users could get on the road, go in their car, meet the service users, the service managers, service users to meet and actually be usable. We have ended up choosing two tools that Ross has mentioned previously. We got the appropriate permissions from the group that managed these tools, the New Zealand HUQOL group and the New South Wales Health group for the APQ6. These tools are very usable by our staff with our service users and well acceptable with them. Back to Ross.
So we don't want to spend too long on the actual tools themselves, but please do come and talk to us, or you can look up the NZ HUQOL group if you want, which is hosted by AUT, if you want to look at the NZ HUQOL brief, and likewise the activity and participation questionnaire. There's some good research articles done on that through Jeff Waghorn and Grant Sarah from Australia. So the 31-item questionnaire, the HUQOL brief, and it's a quality of life one. The activity and participation questionnaire really got me excited because it was the first and the closest measure I've seen to something akin to understanding the experience of social inclusion for people who use services. The collection protocols that we established, these are self-report measures. So consent is by completion, essentially, which means that we don't require compliance. We're not saying you have to do these things. What we're doing is we're informing and encouraging people about why we're wanting to do it. We're grabbing and engaging them and addressing any concerns they have about what is it about, why would I be completing this for, this outcome measure. We chose that we weren't going to have an annual kind of outcomes bureaucratic moment where this month is outcomes month and you all have to do your outcomes measure. We decided that, in fact, if these tools really assist recovery planning, then it actually needs to be a practice tool. So the collection protocol was that at any stage when a person's entering our services or at any stage when they're undergoing a service or a needs review, the HUQOL and the APQ6 would be offered to them by way of understanding where things are at and where things could get better for them. So engaging our people. One ahead. We created a user guide for staff, emphasising the personal reasons why we collect outcomes. One of the things that really engaging and getting staff brought into this was that we weren't asking them to do something in addition to their job. We weren't bolting on outcomes and saying that this is something we need to do or this is a measure we need to complete. We really wanted to emphasise to them those personal reasons that we shared with you at the start about why outcomes and collecting outcomes are important. So what we created, I think we've gone and missed a slide. So the creation of the measures, what we've done is we created these measures and we put them within people's electronic record. And so outcomes are included as a recordable part of everybody's activity and as a part of their service. We have the advantage of both sharing the same client management system, which is record-based, which is provided by Wild Bamboo. So we thought we'd illustrate an example of how within the person's clinical record you can see the activities down the left-hand side of the screen there, which kind of show the alerts, the activities, your recovery planning, and all of the things that you do by way of intervention. We now have outcome tools as one of those activities that are within people's client management system. So the support worker undertakes and completes either the APQ6 or the HUQOL with the person, and then they get to enter it directly into the person's client information system. So it'll pop up like this, and essentially they go through and they answer the questions that relate, the 31 items that relate, and the data and the information gets held directly within the same data systems and the same information system that holds all of our activity and all of our reportable events and things like that. So we begin to get a really comprehensive understanding of what goes on for somebody. We have the potential as well within this for people to write and comment on their own notes and via a feature of record base called My Record. And within that too, we hope that people will be able to go and see their HUQOL and their APQ6 results, complete and undertake the questionnaire and engage with people in discussions in that in their own self-directed way as well.
So right from the beginning, we wanted to keep the staff on board with this. As we said, there was a project group with us three, some others on it, but we kept the staff informed right from the beginning, both verbally at weekly staff meetings and also on paper on newsletters, which were available to clients as well, service users as well. We initially, certainly within Q-nique, identified a couple of staff who were showing particular interest in it. They have been championing it and assisting some of their other colleagues as well in using both the two tools and working with clients with that. We did some fun staff training when we actually used the two tools on each other. A bit of real information, a bit of role playing on some of the more tricky questions, shall we say.
One of the questions in the HUQOL brief is how satisfied are you with your sex life?
So we thought we'd do that role play on that question. We created intranet pages so staff could, if they want, have a look and see where they were with that. We created an information sheet which is shared across both organisations specifically for service users. It's entitled Your Life, Your Views, Your Voice. We're really emphasising with the service users it's by them, about them and for them. It's them, they are doing the tool with the staff. It's an opportunity to have that really good in-depth conversation with whichever support worker is working with them, but it is their tool, their information, their ownership.
Fantastic. So, continuing with the theme of capturing hearts and minds, this initial use of data and information, we were acutely aware that if we were asking people and promising them that we were going to use this data to inform service provision, to improve their practices, and to start understanding what's happening, we actually had to give information back to them in a real quick way and in a way that actually was understandable for them. So we are working very closely with the team at Wild Bamboo to develop personalised reports to give back to people so that upon a second completion of either your HUQOL or your APQ6, a graph is automatically generated which actually shows you progress in particular areas of your life or likewise. We think that's a really important feature because, again, it says this is your information and this is actually about you understanding the important things that are going on for you. We're developing and looking to develop benchmark reports by service and by region. We want to start to understand, do different service types achieve different outcomes, do different organisations achieve different outcomes, and then start questioning each other about why some of those things might be occurring and might be happening. And we've begun to date, so that's future state, we've begun to date to just initially share some information with staff in a way that they can begin to understand. So it's probably less important what this says, and we don't particularly want to delve into the findings of this, but suffice to say that we are grabbing the information that we've got, and there's been 560 odd kind of collections to date, and we've been doing this for about 3 or 4 months now. But grabbing the data and then starting to present it in a table form and giving it back to staff, the first thing it does, because one of the graphs that we've got is it names the individual staff and how many completions of the questionnaire they've had, so that we can identify our early adopters and our champions. And somebody sits there who's completed 19 WHO quals when the other people have done none, and they say, you know, choice, because it gets published nationally and people see their name with a great big black line next to it. But what it also does is it kind of engages people, and they say, wow, what's that about? Why are men less satisfied in score within the social domain of WHO qual than the female are that we work, than the women are that we work with? So they're really starting to question and understand, or question rather, not yet understand, but they're really starting to question what these things might be telling us. So fairly rudimentary, but you can begin to see how some of the information is getting presented back in the first instance to our workforce, in order to keep them engaged in this process, and in order for them to see that we're actively utilising and wanting to use this data to improve our services.
One of the early reports showed pathways doing marginally better than Q-nique in some domains, so that's been a cause